Welcome to our shared stories relating to STD infections from doctors.
In my opinion, as a doctor, for example, I have seen cases where a woman who is sick and potentially risky to everyone around her gets tested in a Ureaplasma checkup, and she leaves very healthy and happy. It's as if she has been cured by one conversation. I am against treatment for Ureaplasma if a person is healthy and has a proper level of defenses in their immune system. The issue, however, is that more and more frequently we are seeing people with seriously damaged immune systems. It happens. Here, too, there are some causal mycoplasma cases.
But for my patients. A doctor I know very much forbade one of my patients from getting pregnant until she and her husband were cured of ureaplasma. Over a period of 2 years of treatment, some antibiotics were given, control again showed urea, other drugs were prescribed. Again, it appeared after a while, and so on in a circle for 2 years, from one drug to another. But the point is that you cannot completely get rid of such infections 100%, and there is no need to try to do that. On one occasion, a woman came to me terminally ill and left completely healthy.
There are absolute pathogens, that is, those microorganisms that, when they reach us, cause harm and illness. For example, gonococcus is the agent that causes gonorrhea. Treponema pallidum is the causative agent of syphilis. Chlamydia is one of the main causes of tubal infertility. HIV kills the cells of our immune system, and so on.
Many conditional pathogens live with us in peace and harmony. Only sometimes, rising in larger numbers than they should, they cause disease. Conditional bugs include Candida. When it multiplies, it causes candidiasis or thrush, Gardnerella, and many other bacteria. In my experience, they cannot be completely eliminated, and they do not need to be treated in a healthy woman who is not bothered by anything if she has excellent and strong health.
Mycoplasmas and ureaplasma are the smallest free-living organisms. They don't even have a cell wall. What did these kids do so wrong? The vast majority of asymptomatic healthy adults have cases of them. MGen and ureaplasma are part of the normal microflora of the vagina. You can get pregnant without problems and give birth to healthy children. But for non-healthy persons, that is a different story.
Complications. Yes, home kits can help prevent the development of associated non-specific inflammatory diseases of the pelvic organs, such as bacterial vaginosis. Still, they are conditional pathogens like Staphylococcus, Streptococcus or Gardnerella, and will be treated with standard antibacterial therapy.
In my opinion, the presence of MGen hominis and or Ureaplasma urealyticum in your body cannot be the cause of infertility, habitual miscarriage or congenital malformations of the fetus, etc. However, also, a special PCR examination is needed to detect ureaplasmas. Except for the Mycoplasma genitalium variety, pregnant or non-pregnant women should not carry out treatment unless they have health issues. In such poor health cases, they do indeed need to carry out treatment for detection. We do not need to search for conditional pathogens in the vagina using the PCR method, qualitatively, in the absence of any complaints. But if there are complaints, then, of course, it's responsible to screen to find out about any diseases. In my opinion, the only exception is for Mycoplasma, where it's a good idea to screen, even if there are no complaints about symptoms.
The world has no global coordinated approach to be carried out. That is, no special examinations to detect Ureaplasma urealyticum. Only in some countries is this formally done. Maybe those countries are leaders offering more choice and providing a path for treatment for those of poor immunity that absolutely need it.
I worry about my patients with all my heart, and this is only the path to professional burnout. Well, how can you not worry? Look at this yourself. Just this week, 3 women came to see us who have been treating carriers for a long time while they need serious treatment of the underlying disease. Now, I will explain my pain. Ureaplasma is one of the many, well, actually very many dozens of self-care solutions for the normal microflora of the female vagina. They are, in my opinion. I think most of these are fairly harmless microorganisms, and only in rare cases, and more often in association with other microorganisms, can it cause gynecological diseases. Only the lazy people, well, maybe that could include me too, most of the time simply do nothing at all. I can't get my head around the point that we doctors have not written more about the massive, unfounded obsession with AIDS, STD treatments of natural events. But I guess it's because we can't push people to overreact, and that can include the ones with poor health and/or immunity that actually do need treatment and testing. But for strong and healthy women with ureaplasma, in my view, the fact is that there is no need to be examined, much less treating its carriage. But there would be no symptoms anyway for such strong women. Nevertheless, I hear questions and sometimes demands about the treatment and testing absolutely every working day. And you know I take this calmly, but everything is simple here. I explain, reassure and insist these are their stories. But just sometimes, ureaplasma has risky consequences. The stories of 4 of my patients will tell you more eloquently about my pain. At the beginning of summer, a woman planning a pregnancy contacted us. Even before the start of the appointment, I noticed her increased anxiety, suspicion, and some initially hostile stance and attitude towards me. This woman had tried unsuccessfully to recover from an infection for a year and had therefore been forbidden to have sex by her own stressed thinking, and also that she and her husband postponed the desired pregnancy indefinitely. But the most unpleasant thing, which has no reason at all, is that over this year the AMH level has lowered from 0.9 to 0.2. AMH is an indicator of ovarian reserve, that is, ovarian cancer, which is great news as she was in better health. And this is in a woman who previously had been planning a pregnancy. Today, this patient of mine is already in her 2nd IVF treatment. Now she is a different story. And there is a case of another woman. She asked for the same thing. It was necessary to monitor the cure after treatment for a ureaplasma infection. She received repeated courses of antibacterial therapy and visited gynaecologists every month and more than once. At the same time, the woman herself was dramatically bothered by certain pains during periods and sexual intercourse. Without proper mycoplasma treatment, this woman's chronic pelvic pain got worse, and endometriosis, which is its cause, further rose up as time progressed. Furthermore, another patient recently wrote to whom I had refused treatment for anaplasmosis. The woman did not heed my recommendations and found a doctor who organized this treatment. As a result, a young healthy woman in the very early stages of pregnancy took long-term antibacterial drugs that had contraindicated her system during pregnancy. And then as a result, what now? She had to have screening for fetal development anomalies, termination of pregnancy. I don't know. In conclusion, results of a very in-depth mycoplasma test reveal the state of the vaginal microbiota. As you can see, areas are also present there. Still, they do not play the most important role. The main problem here is the colonization of the vagina by anaerobic flora, mainly Clostridia. Of course, in my opinion, naturally treating ureaplasma itself will not change anything here, but will only delay the results and treatment of the real disease. But you can't be sure if it's one of the other infection types. So you need to be tested anyway to know which one so you can treat it. In conclusion, I will be banal and repeat. Ureaplasma is not a sexually transmitted infection and is not a hidden infection. It is not necessary to be checked for it, but you need to check what you have because it could be one of the other infections that, in my opinion, should be absolutely tested, identified and treated, especially when planning a pregnancy or during one. My opinion is that isolated cases should not be treated, but testing I can agree with. And if you have weak immune system, then yes, you should give your body some assistance and get treatment for it.
To subscribe to more stories on this channel, please click on the subscribe link. It's free to get more stories. We love to share them as we can see that around the world we often have the same health concerns. May I remind you please to send us your story so we can publish it for you on video in this community channel. Also, if you subscribe today, you will receive a personalized coupon voucher for 20% off any laboratory product or appointment during your channel lifetime. And don't forget to please show your appreciation and hit the like button so we're motivated to recreate more stories for everyone.